Итак, мы начинаем. Доктор Лоуренс Фанг из Станфордского университета.
I'd like to thank all of you, and especially the Moscow Autism Challenge Center for inviting me to speak with you today. And especially Maria and Tanya, they are really the most hospitable people I've ever met. And the Russian new friends of mine, I feel like you are really the nicest people. So thank you for making my visit very pleasant. So I'll also thank you for sticking around. This is one of the last talks, so you must be quite tired after 3 days. I'll introduce myself a little bit. My name is Lawrence Fong. I'm a psychiatrist specialized in autism. I do different kinds of research, including neuroimaging, including medication intervention research. And in the last couple of years, I've been focusing on an effort that is really about maximizing the potential of neurodiversity. So I'll tell you more about what neurodiversity means and what we are doing at Stanford. So what is neurodiversity? So neurodiversity is really about regarding individuals with differences in brain function and behavior as part of the normal variation of the human population. When you're looking at any trait, just like the height of someone or weight or anything that you can think of to describe a human being, you can think of the normal distribution. So the green area here, the green area is the normal. So most people are in the normal range, like about 2/3 of it. And when people are above average, they may be in the yellow range. When they're really, really good, they're in the red range. And that's true also for not being as good. So there are some people that are going to be below average, and sometimes really so much farther away from most people, and you would notice the difference of these people. So most of the time when we are thinking about how a person is capable or not capable, you can use many different ways of measuring. One way that is very common that we use to measure intelligence is IQ. So a IQ of 100 would be average. So one standard deviation above is 115, and 2 standard deviation would be 130. So anybody that is above 130 would be quite gifted. Above 115 definitely is above average. And when people have IQ of, say, 70 or below, in psychiatry, we consider them to have intellectual disability. So this is only one way of thinking about how to characterize intelligence. There are many different ways that we can appreciate a person's abilities. So Howard Gardner, who is a professor at Harvard University, has thought about multiple intelligences. So just like someone that's very capable of playing instruments, musical instruments, able to sing very well or pick up the pitch, perfect pitch, those are very gifted people musically. And there are also people that are very much able to understand the visual spatial information. So that's the second point. And those people usually are people that are like good at navigating, and they are sometimes very able to understand three-dimensional information. So some of them may be very good chemists that understand how molecules are arranged and so forth. The third area is verbal linguistic. Those people are people that are very good at understanding words, using words, and so forth. So they can be people that are journalists or writers and so forth. And there are people that are very good in their mathematical abilities and understanding logic and so forth. And those people, a lot of the time, they can be good in science and engineering, and they are able to do a lot of the jobs that require calculations and physics and so forth. The next area, next domain is bodily kinesthetic. So those people that are very good in this domain are the people that are very good athletes or people that are very, very good at dancing or something like that. So the last two are interpersonal and intrapersonal. So interpersonal is really about the abilities of being able to relate with each other and understand the social interactions very well. And intrapersonal is really about understanding himself or herself. So some people are very good at multiple domains, but sometimes some people are only good at one or two, and sometimes they can be quite weak at some others. So one example that I want to go over is Albert Einstein. So we also look at the bell-shaped curve and look at where he might lie. So this is definitely a guess, but we'll take our best guess. So in terms of musical, rhythmic domain, he is probably above average. He played the violin and he likes to play that a lot, so he's probably good, but he's not like a very accomplished musician. He's very, very good at visual spatial, as we can all imagine, because his physics is really above the level of almost anyone. Verbal linguistics, however, he's probably just a little bit lower than average. He actually didn't speak until he was 5 years old, and he had a lot of problem growing up, really reading and so forth. And at one point during elementary school, the teachers was telling him that you're really doing not so well in school. So think about a genius like Albert Einstein. He was actually starting in childhood not as the brightest student. In terms of logical mathematical, he is probably just way on the right, maybe 10 standard deviation above everybody. I don't know if you can see the bottom one, intrapersonal. He's not so good, so he's probably below average. And interpersonal, probably even worse. And bodily kinesthetic, he's probably average. He at least can ride a bicycle. So when we are thinking about Albert Einstein, what we imagine, what we really remember is really how good he is in terms of the visual spatial and logical mathematical domains, because he really changed the world by really applying what he is very good at. That's his strength. We really don't care about his interpersonal skills anymore. So what does that tell us? So for some people that are good at certain things, if you are able to help to develop the strengths, you can really make this person quite remarkable. And so I think Dr. Hadley had this paper as well, not in this form, but Neurodiversity as a competitive advantage is the title of this paper in Harvard Business Review by Bob Austin, basically talking about how some individuals on the autism spectrum can really excel, and they, in one case, someone in the team who is on the autism spectrum saved the company $40 million because of the innovation he brought forth to the team. So neurodiversity can be a competitive advantage. It's not only a social justice act, it's really making the bottom line for some companies. So now I'm going to talk about Streamspace model of neurodiversity. Typically, in the medical community, we're describing different conditions and disorders such as dyslexia, ADHD, autism, and so forth. So these are all about describing the deficits. And the reason why the deficits are described is because in the medical community, the way to contribute to the health of patients is to figure out what's wrong, and then you try to normalize whatever is not doing so well. However, if we think about the strength-based model, we are thinking about things like hyperfocus, attention to details, deep interest in particular topics, excellent fund of knowledge. So these are all really good things, and a lot of the time individuals on the spectrum has these. And sometimes they are very determined, and they are very good at visual thinking sometimes. And people with autism can be quite creative, and people with dyslexia can be quite creative as well. And usually when we think about entrepreneurial spirit is more for people with dyslexia, but I've also seen people on the spectrum being entrepreneurs. So what I'm trying to tell you is that there are certain challenges that we can see with people on the autism spectrum. And depending on in the context, you can think of the same trait as perseveration or persistence. It's really depending on the context. Also, the people with autism, they are not so good at seeing the big picture, but at the same time, they are very detail-oriented. So if you are thinking about solving a problem that really requires the details and not the big picture, you have a person that really can uses his strength or her strength. A lot of the time, individuals on the autism spectrum, they have few interests, but because of that, they really get into the details and they know everything about the subject. Perspective taking is a problem sometimes for individuals on the spectrum, but because of that, they are also very concrete and very honest. Individuals on the spectrum, they are not so good at social interactions, but when they have friends, they are usually very loyal and they are very good friends. And they can be having very lasting friendships. So the Streamspace model of neurodiversity, there are mainly three components. I'm going to unpack what positive psychology is and positive psychiatry is, and also the Chickering 7 vectors of development. And one thing that we also want to emphasize is that we want to consider that autism is really a condition instead of a disorder. And we want to acknowledge that there are challenges, but we don't want to always emphasize that there are deficits. Because if you look at the previous slide, the deficits that you can label, depending on the context, you can actually label them as strengths. So it's actually better for us to think about, in some situations, there are challenges, but they are not truly deficits. a last point about kind of general concept is we want to think of this kind of model to be able to be applied to the entire spectrum. It may be a little bit easier for us to think about the higher functioning individuals on the spectrum using the strength-based model, but we should be attempting to, in every single attempt, to try to apply it to all individuals on the spectrum. Because if you're trying to look, you may be able to look at something that is quite remarkable, and the strengths can be used to develop the person. So the first point about positive psychology is that positive psychology is a field that was built by these two people, Martin Seligman in University of Pennsylvania, and VII Csikszentmihalyi, who was in University of Chicago for many years and then went to Claremont University. So what they believe is that the core of positive psychology are really about well-being, contentment, satisfaction. Flow is basically the immersion of the person in whatever he or she is doing and get a lot of satisfaction out of it. So the outcome is that the person is going to be happy, and we also think about hope and optimism. So this paper has been published, was published 20 years ago and has been cited over 16,000 times. And over the years, there are many people that are trying to define positive psychology, and in this paper, the authors attempted to find the themes of the definitions of positive psychology. And there are 53 publications that have attempted to define positive psychology, and there are three major themes. The first theme is really about strength. It's more specifically focusing on the virtues, the character strengths, the positive personality traits, and related attributes and abilities and talents. The second is really about happiness. It's really about the phenomena indicative of happiness, positive emotional well-being, subjective sense of fulfillment and satisfaction with quality of life. The third is really about growth. So they define developmental process of becoming growth, fulfillment of capacities, actualization of potential, and development of the highest authentic self. So I'm a very simple person, so I just take all of them and say this is really positive psychology. We want to think about strength, happiness, and growth. Those are the three major things that we are trying to emphasize. So how do we apply and conceptualize positive psychology in individuals with autism? So we want to think about developing, just like what I said again, the strength, happiness, and growth. And more specifically, we want to raise awareness of personal strengths. We want to increase trust in personal ability. We want to learn, we want to help them learn to engage in relationships, and also increase self-satisfaction through success. We also want to move the neurodiverse individuals away from being negative, so negativity and immobility, just like anxiety, depression, executive dysfunction. We can actually find ways to get them to focus more on the positive instead of the negative. And in the field of psychology, a lot of the time, we think of cognitive behavioral therapy, for example. And for those people that know cognitive behavioral therapy, it's really about understanding what are the thoughts, and the thoughts, if the thoughts are bad thoughts, or those are usually called automatic thoughts, bad automatic thoughts can give you very bad feeling. So you won't feel good because of the negative thoughts. And in cognitive behavioral therapy, we want to change people's automatic thoughts from negative to positive. So this is basically positive psychology in many ways. So the bottom line is there are some specific ways to figure out how to practice positive psychology. And we build strength, we utilize interests, and this is a really important point. The first and the second are not identical. The first is really anything that the person is strong at, and the person may not be interested in what he or she is strong at, but if that person can build the strength and utilize the interest, if that person is very passionate about a certain field, it is definitely something to develop. And the third point that is important is positive behavior support. Try to encourage the people, the person to focus on positive behavior and how the positive behavior can be sustained. And the last point is accommodating learning differences through universal design for learning, which is a way to really find ways of allowing the person to learn in multiple different ways. Some people are more visual learners, some people are more auditory learners, some people have to really work on something with their hands in order to really understand what's going on. The idea is that if we use positive psychology, we try to offer different modalities to these people so that they can maximize their chance to learn. So I'm going to talk about the difference between traditional psychiatry and positive psychiatry. So here, in this column is traditional, and here is positive psychiatry. So the first thing is, in traditional psychiatry, pathology, whatever that we can define as deficits, are what's being characterized. But in positive psychiatry, it's really about positive attributes and strengths. And when we are doing research to understand positive psychology versus traditional psychiatry, traditional psychiatry would focus on what are the risk factors and what are the things that are not right. But in positive psychiatry, we focus on protective factors, what can actually get the person to be doing better, instead of what are the factors that would get this person into trouble. And we think of the biology that's relevant to positive psychiatry being neuroplasticity, how the brain can actually be more plastic and more able to grow and be able to do more things. And the treatment goal for traditional psychiatry is really about symptom relief, taking away what's not normal and trying to move the person from wherever he or she is to normal. But another way to look at it is we can increase the well-being and growth, and that's basically what positive psychiatry is in terms of its treatment goal. The main treatments for traditional psychiatry would be medications and short-term psychotherapies, but positive psychiatry is very different. We think of psychoeducational interventions to enhance the positive attributes. So we may not need medication. So when you think about psychiatry in general, it doesn't mean medication. So in fact, I'm a psychiatrist and I do prescribe medications, but I oftentimes have to make sure that I exhaust everything that is not about medication first before I get to medication. In terms of prevention, traditional psychiatry do not really think about prevention. But positive psychiatry is, everything is about prevention. We want to to make sure that things are being done right, and streams can be magnified, and the consequence of that is going to be you don't have symptoms. So this is what we are hoping for. So the third major component of the stream-based model is the Chickering's 7 factors of development. So there are 7 things, and in the next 7 slides I'm going to unpack what they mean. So the first is developing competence. So everything that I'm talking about here is really about, it's an example of how we can practice this triggering 7 factors of development in, say, the college years when someone is in college. So in every single factor, what we are trying to do is to focus on what we can offer to the neurodiverse individual, as well as what the school officials can do to change the or can offer to the neurodiverse individuals. And the third is what the mental health providers can offer to the neurodiverse individuals. So in terms of developing competence, sometimes neurodiverse individuals really need a little bit of help from professionals, and so their job as neurodiverse students would be, they have to let people help them. And they have to develop strengths and interests through whatever the opportunities he or she has in college. And oftentimes it's really about learning something new through courses or other means. And the neurodiverse individual can also develop non-academic interests such as music and sports, and those are really important so that the person can balance his or her life and not be putting himself or herself into a situation that is really about only one thing. So having the guidance to get them to balance different parts of their life is very important. For school officials and neurodiversity professionals, what they can offer would be tutoring, academic coaching, and also we can train the professors so that the professors know how to teach the students and also know how to help the students by detecting certain things that's not going right. The second factor is managing emotions. That again, the neurodiverse individuals have to seek help before the professionals can help them. And they can learn about how to manage their positive and negative emotions. And during the college years, there are a lot of ups and downs. Most people have ups and downs. So, and a lot of the time, this is the period that's, for the first time after high school, they have to do everything on their own. So this is the time to learn how to manage emotions. And also developing a support system, making friends and finding colleagues that have the same interests and so forth, while maintaining the support from family and close friends. For the school officials, what they can do is to reach out to the students, which is usually not done. And what we are hoping is that in our institution is to try to change things by not only getting them help when they ask for it, we will offer them help. And also for managing emotions, sometimes psychotherapy is needed, and if psychotherapy is not helpful enough, sometimes they do need medications. The third factor is moving through autonomy toward interdependence. So this is not independence. This is really a step more in that you're not only trying to do things on your own, but you do the things that are necessary with the people around you, because the world is really not only as a one-person community, is a big community with a lot of people. So knowing how to work with others will be very important. And what we mean by that is they have to learn how to be competent in, say, active listening, collaborating. So in school, there are a lot of the time projects that require team collaboration, and that's the time that they can learn about how to develop interpersonal competence. Before college, neurodiverse students oftentimes really depend on their parents, and there's nothing wrong for parents to be helping them. But at some point, the parents would need to get the neurodiverse individuals to really take over their own care, their own development. And by kind of separating from parents, they would have to start relying on other people, like friends and maybe other adults in school that they trust. And they have to start participating in social activities. The second major area is the school officials can offer group activities and also arrange peer mentors to help the neurodiverse individuals. And mental health providers can also organize social skills group to enhance the social interaction abilities. The fourth factor is about developing mature interpersonal relationships. So for the neurodiverse individuals, they just have to participate in social activities, and they can develop more in-depth sharing and less clinging, trying to really develop the relationships with others. And one thing that is important for neurodiverse individuals is to recognize that relationships a lot of the time are not perfect. And because neurodiverse individuals or individuals with autism, they oftentimes have some level of cognitive rigidity. They want everything to be just so, they want things to be perfect. And sometimes when the relationships, the friendships are not perfect, they are just not going to continue, and they would give up, and this would not be helpful for them to learn how to be developing relationships, which is something that is not very easy for individuals on the spectrum. And nurturing relationships, definitely. Every relationship, you need to put effort to it, and they need to learn that this is what they need to spend time on. So for the school officials, what we can do is to make sure that the school is having a culture of accepting individuals with differences. So cultivating inclusion is an important aspect, and educating the other students, the neurotypical students, and the professors about neurodiversity will help cultivating the environment to accept neurodiversity. And lastly, educating neurodiverse individuals about intimacy is important. They may start to want to have romantic relationships, and sometimes they don't know how to deal with that. Factor 5 is establishing identity. In the college years is really the time, the formative years of development. So for the neurodiverse students, this is the time to really figure out what they want their identity to be. And sometimes that means they would have to accept their neurodiverse identity, and they may want to disclose their identity to their peers, but sometimes they don't. And there is no right or wrong about disclosure, in my own opinion. I don't think neurodiverse individuals have to disclose their identity if they don't want to. And especially if they think that disclosing actually can hurt them. That's not something that we want to push them to do. And also accepting identity with respect to physical appearance, cultural influence, ethnic heritage, and sexual orientation. Those are really about understanding identities, different types of identities around the neurodiverse individual. It's not really about the neurodiverse individual's own identity, but really understand the more complex world with different identities. We want the school officials to understand the needs of neurodiverse individuals in terms of establishing the identity, and sometimes individual counseling is needed in order to really consolidate the identity formation. Factor 6 is developing purpose. So for the neurodiverse individuals, this is the time to explore what they want to do in their life. They have only 4 years in college, and after that, they may have a lifetime to pursue a career. So these few years is actually a very important time. And for school officials, we'll be charged to help them with finding ways to understand their strengths so that they can enter the workforce the best possible. And this last factor is developing integrity. In general, individuals on the spectrum, they are very much people that can understand the rules and want to stick with the rules and so forth. However, sometimes there are certain societal rules that are not so simple or obvious. So this is the time for them to understand what are the subtle differences in certain social interactions and understand about ambiguities and uncertainties. So for the school officials, we need to provide specialized training so that they can navigate those social interactions, and mental health professionals can also help through individual counseling. So in the next 20 minutes or so, I'll talk about how we apply the strength-based model of neurodiversity in the Stanford Neurodiversity Project. So there are 6 objectives of the Stanford Neurodiversity Project. The first is to really establish a culture that treasures the value of neurodiversity. The second is to empower the neurodiverse individuals so that they can establish their identity in a healthy way, and after that they will be able to have that identity for the rest of their life, and that can help with not only the college years but the entire lifespan. We want to attract, if we are going to be able to do it right, to make the environment really welcoming for neurodiverse individuals, then we can attract neurodiverse individuals to Stanford, which is what we want to do. And we want to train talented individuals that may be neurodiverse or not neurodiverse to serve the neurodiverse population. We want to disseminate the Stanford Neurodiversity model locally, nationally, maybe even internationally, since I'm in Moscow. And the bottom line is that we want to maximize the potential of neurodiversity, not only for the neurodiverse individuals, but for all of us. So I direct the project, and the sponsor of this project is the department chair, Dr. Laura Robbins, and we also have 2 other staff members. And there are 4 major anchors in the Stanford Neurodiversity Project. The first is about education. Educating not only the neurodiverse individuals, but the general public and the university. We collaborate with various departments at Stanford and also service organizations to provide services such as helping individuals on the spectrum to gain employment at Stanford, We also help with the students at Stanford to land jobs like internship positions or full-time positions in major corporations. We think advocacy is very important, so we work with the legal scholars in the law school. We also want to disseminate what you are doing, so that's the major reason why we want to do research. We want to measure success, and after we can develop that this is a very good, viable method, then we can disseminate it. There are three major key initiatives in this project. The first is about awareness and education. The second is about neurodiversity at work, basically employment and wellness or mental health. And the third is about independent living skills and housing. So the special interest group for neurodiversity, basically that's formed about a year and a half ago. Initially, it was just the 4 or 5 of us who are faculty and staff at Stanford wanting to advocate for neurodiversity and trying to find opportunities for neurodiverse individuals to work on campus. And the first meeting a year and a half ago, we thought there's going to be only 5 of us. Over 20 people showed up. And then after that, every month we have a meeting. And we bring in a speaker to talk about various different topics. So over time, the word went out, and the people around us in the Bay Area and California call us and want to call in or participate in the monthly meeting. So our group grew from the 20 people in the first meeting. Now on our distribution list, we have over 150 people. So the topics that we talk about are really very diverse. We talk about things that would be relevant for employment. We also bring in people that talk about student support program. We bring in people that are self-advocates that know what they want and what they think can be helpful to develop programs at Stanford and other places. So, so over the last year and a half, we have a lot of very good speakers, and that's why we have a lot of participation around the Bay Area. And some people even in Europe wants to call in, but because of the time difference, it's very difficult for them. So the second program that we do is neurodiversity awareness program. Basically, it is me talking about neurodiversity, just like what I'm doing now, going to different places. So I've spoken about 30 times around the campus in different groups, as well as outside campus. Like today, I'm in Moscow, which is the farthest so far. I don't know how far I can go. Anyways, so a lot of the time, the awareness program can generate interest. And in some cases on campus, there are managers that are interested in neurodiversity, and they want to hire someone that's on the spectrum. So at that time, we are going to help them. So basically, this slide is showing you that we are building the alliance. We are not operating in isolation. We have to get buy-in from many different departments around campus. And we also collaborate with a lot of companies like SAP. Jose Velasco is the head of the Autism at Work program in the Americas. We have phone calls every couple of weeks just to make sure that we are doing things not in isolation, and we help each other. And even other institutions around us and away from us, there are many of them that are working together on advocating for neurodiversity. The third is a course on neurodiversity. At Stanford, we are quarter system, so there are 3 quarters plus the summer. So in the winter and spring quarters, I teach a course on neurodiversity. So we talk about various aspects of autism and ADHD, as well as dyslexia. We talk about not only the behavioral manifestations, but also the societal impact and as well as the neurobiology. In my spare time, I'm a neuroscientist, so I like to talk about neurobiology. So in the second quarter, we use a methodology called design thinking. So design thinking is really a 6-step process. The first step is to empathize. So the students are encouraged to really understand the neurodiverse individual's perspective, really thinking in their shoes, and then try to define exactly what problem they want to solve or want to improve on. And then they have to collectively collect a lot of ideas, and then they will build something and build a prototype, and they even have to test it, and they have to do it iteratively. At Stanford, we go crazy on things, and sometimes we like to go through this kind of iterative loop a lot, and sometimes we go through 150 times, 200 times. And after that exercise, we become experts on whatever problem we are trying to solve. And in some examples, there are students that actually form companies after a year's work using this approach. So neurodiversity seminar series, this is a seminar series that's designed to help the managers and the co-workers and mentors of individuals on the spectrum who are employees during the transition time, the 12 weeks or so in the beginning of employment. So we talk about some high new topics, things that can help managers and co-workers to work with neurodiverse individuals. They also have a lot of questions usually, so we use that time to make sure that they are answered. The student support program is probably the biggest effort right now at Stanford. It's a comprehensive program that has many components. So we have the summer transition program to help the freshmen to transition from high school to college right before they start their fall quarter. And we have independent living skills support for them. We also help them with social skills and accommodations if they need accommodations. And sometimes they need learning support, career development support, mental health support, and almost everything else. So we try to have peer mentors who are Stanford students who know the campus really well. We train them so that they work effectively with individuals on the spectrum. Snp Staff is basically Stanford Neurodiversity Project staff. We basically organize all the activities. We have an affinity group that are composed of the neurodiverse students that want to help each other. We work with the Office of Accessible Education to make sure that the students get their accommodations. And we work with the learning specialists to make sure that our students learn the best possible. And we work with the Career Center to help with identifying the opportunities for internships and even for full-time positions. We work with the Student Health Center, which is called VII Health Center. I also direct the Adult Neurodevelopment Clinic, and basically we provide mental health support. So the neurodiverse individual in school has a lot of support. So on your left side is academic life support circle. So there's a learning specialist, there's a career coach, career mentor, and we also have an Snp staff that would be monitoring the activities. We have a personal counselor offered to the neurodiverse individual if necessary, and peer mentor is always going to be part of their program. Sometimes if the student want family involved, we can also have family involved in the support circle. We don't really monitor the peers. We have no way of doing that, but we hope that the peers, the friends that the neurodiverse individuals make can also support them. So the second initiative is neurodiversity at work. So it is a rather elaborate process that we help with the managers and the whoever that are in the position to hire individuals on the spectrum. And the first thing is to have the awareness training. So this is like an awareness training. And then after there's interest in hiring someone on the spectrum to the manager's team, we provide consultation for the position, trying to understand exactly what the position is about. And we also can help with identifying people that know the right candidate. We have established a really big network of providers who know the candidates that have different background. So after we find a way to potentially present the candidate to the managers, we train the managers. We make sure that they are going to be not following the typical path of hiring. We know, just like what Dr. Happy was showing us, is that individuals on the spectrum, they don't really give the very good first impression. And a lot of hiring managers really use that gut feeling and really screen people. And individuals on the spectrum are really disadvantaged because of that. So because of this known fact, what we are trying to do is to help the managers know how to understand the candidates and vice versa. So instead of just scheduling the interviews, we actually ask both the managers and the team and the candidates to write a bunch of questions that they are going to use in their interview, and they will exchange them ahead of time. And they are not allowed to ask any open-ended question like, tell me about yourself. That's a forbidden question. So they have to ask questions that are really about the position, and they really have to ask questions that are about the qualifications and the match. And that's what the neurodiverse individuals are good at. They can do the job really well. They just don't really interview so well. So we also help with hiring, and sometimes there are some particular needs that the neurodiverse individuals and the hiring manager needs, such as accommodations. Sometimes they do need to have some accommodations ahead of time, so we arrange for them. And I also told you about the 12-week ongoing support for the neurodiverse individuals as well as the manager. So what we want to make sure is that the team is comfortable with working with the neurodiverse individual, and we're not going to just start the employment, help them with the employment and then walk away. We make sure that they are going to be having a good environment to work with the neurodiverse individual. So the neurodiverse individual also has support circles, just like the student. So there's a workplace support circle. So this is actually very similar to the SAP support circle. It had also the team manager is in the workplace support circle. There's the mentor and the team buddy. as well as the job coach or life skills coach. We also have a study coordinator who helps with understanding whether or not the neurodiverse individual is getting all the support they need. The job coach, a lot of the time, would kind of disappear in 3 months. That's usually the length of time that in California, most job coach only support for 3 months. And there's also a personal life support circle with a personal counselor and the family. And then the adult neurodevelopment clinic, very quickly, we do diagnostic evaluations, behavioral consultations, and various treatments, including cognitive behavioral therapy, social skills training. We do group therapy, we do medication management, and we even do psychiatry. So the major point is that this is a clinic really designed for neurodiverse individuals. So basically at this point, I want to ask, how can we work together to maximize the potential of neurodiversity? Almost every single one of us can actually do something about it. So whether or not you try to tell people about neurodiversity, or you may be, if you're a manager, you think of maybe you have opportunity to hire someone that's neurodiverse, or there are other means. So this is the website for the Stanford Neurodiversity Project. You can just Google Stanford Neurodiversity and it should pop up. And in summary, neurodiverse individuals offer a lot to organizations if they are given the chance. Neurodiverse individuals, they have specific challenges that can be overcome. The Streamspace model of neurodiversity incorporates positive psychology, positive psychiatry, and also the developmental perspectives of the 7 vectors of development. And finally, Stanford Neurodiversity Project is really about maximizing the potential of neurodiversity. We are fortunate to have support from philanthropists and the Department of Psychiatry. And here are the members of the team that's making all of this possible. So I'd like to thank you for your attention, and I can answer any question you may have.
Так, вопрос, пожалуйста.
Mr. Fang, I'm trying to speak English.
Okay.
I would like to, first of all, I would like to express my great respect for the significant job you've done at the university. It's really, the amount of job is really very amazing. And please tell me how can ASD students enter the university? Should they enter exams? And do you have maybe in the future projects of cooperation with Russian universities? Thank you.
Yeah, thank you for your question. So the entry criteria for neurodiverse Stanford student is the same as any Stanford student. So they have to do really well in high school, and that's how all the other Stanford students got accepted. So so in terms of like doing projects with other universities, we have requests from other universities to figure out like what we are doing and so forth, and we are really wanting to collaborate with everyone. So if you have interest in collaborating with us, send me an email. I can give you my card. You can just tell me what ideas you have and whether or not it's possible. We collaborate with people from Europe. There's actually a banker who is like the head of strategy of a major bank in Ireland. He's actually now a visiting scholar. I'm in Russia now. He's actually in California because he's a visiting scholar in my group. And the next 3 months, basically, we're going to develop a project that he can bring back to Ireland, to his bank. So I think we can be very creative and figure out something that can be mutually beneficial.
Еще вопросы?
Yeah, I would like to thank you very much again for all the efforts that you guys are doing in Stanford. That sounds really amazing. And I have a question about the entering again. So you said you have to do really well at high school. Do they need to, or normally how it works, do they attend the high school for neurotypical kids? Or yes, they do?
Yeah, typically the students that we know that are neurodiverse, that are at Stanford, they sometimes, a lot of the time they have special education in their regular school. So they do have support from special education, but they, a lot of the time they don't come from a special school. They just come from a regular school.
Yeah, but regular school that has special education department.
Yes.
Okay, thank you.
Yeah.
Спасибо большое за доклад, за ту работу, которую вы делаете. Скажите, а сколько времени после трудоустройства молодых людей раз происходит поддержка? И поддержка со стороны наставника, менеджера бади и...
So in the first 3 months, they do have support on a weekly basis, and then after 3 months, they can continue to receive support on an as-needed basis. Does that answer your question?
Новый вопрос.
Спасибо за ваш доклад. И в качестве, я слушаю тех, кто здесь выступает, понимаю, что у нас очень разный контекст с вами, да, очень. И просто как бы для понимания, что ли, этого контекста, существуют ли в Соединенных Штатах Америки или, может быть, в Европе какие-то законодательные ограничения в части психического здоровья и иных каких-то вещей, занимать, так сказать, людям с аутизмом, с другими расстройствами определенные должности или заниматься какими-то деятельностями. То есть вот как это у вас? У нас мы знаем, как у нас есть. То есть может ли быть законодательно запрещено, значит, человеку с таким расстройством, не знаю, заняться тем, что он хочет? У вас.
Just want to clarify, are you talking about going to school or the employment, the job?
Employment.
Yeah, that's a very good question. So we work with legal scholars and also the employment relations colleagues who are all lawyers. They make sure that whatever we do is not violating any rules. So what we often do will be, we already have good relationship with the university human resources people, And for whatever jobs that we are trying to facilitate, we work with the local human resources colleague to make sure that we are really observing all the rules that will be reflecting equity, to make sure that everything is fair. But basically what we want to do is to make sure that there is accommodated interview as a option for candidates.
Do you have particular limitations in terms of the government, that a person with autistic disorder cannot have this or that job position? Like he cannot, for example, be a doctor, or he cannot be a lawyer because of autism?
No, there's no such limitation.
President of the United States. There are no such limitations.
I don't think so.
Bravo. Bravo. Еще вопрос.
Скажите, пожалуйста, как вы разговариваете со своими особыми студентами об их особенностях? Ну, как этот разговор начинать, как его проводить, и что делать, если сам студент свой диагноз понимает весьма по-своему и в негативном ключе?
So the question is about if someone finds their identity, their autism identity, as a negative thing. So how do we speak to the neurodiverse individual? So the positive psychology is the way that we are doing it. So basically, we are focusing on identifying what the strength of that person is, and emphasize to that to the neurodiverse individual that the label, the diagnostic criteria, the causing the person to have a diagnosis, that's not really defining the person. It's really about the person's strengths to identify the person. So we try to focus on that, and hopefully over time the individual would shift the perception of the identity and have a more healthy identity.
Еще вопросы? Окей, тогда вот у нас еще есть чуть-чуть время перед тем, как Александр сейчас выйдет на сцену. И мне бы хотелось, чтобы профессор Фанг рассказал про концепцию детской шизофрении и аутизма. Потому что у нас в стране, да, диагноз детской шизофрении и аутизма очень часто, я даже не знаю, какой глагол здесь сказать, очень часто ставят один вместо другого. И я знаю, что у вас у всех разные мнения по этому поводу, и вообще ведутся дискуссии. Вот он психиатр, и пусть он просто расскажет, как эта картина выглядит в Штатах, и как там относится вообще к концепции детской шизофрении. Do I need to repeat it in English? Or you got my question well?
So you're asking me about the diagnostic criteria for autism versus childhood schizophrenia.
And I just want you also to specify how come autism is exactly different from schizophrenia, because they overlap. Yeah, there's certain comorbidity. So if you can just just talk on how it's visualized and how it's understood in the United States in psychiatry, please.
Yes. So I think a lot of us, if you are a parent or a provider, you know very well the diagnostic criteria for autism. So in the newest diagnostic criteria from DSM-5, basically is the newest diagnostic criteria for all the psychiatric disorders. So autism basically needs 3 social communicative criteria plus 2 non-social communicative criteria in order to have a diagnosis of autism. So the 3 social would be the 3 social criteria. The first is the lack of social-emotional reciprocity, no back and forth communication. The second is the lack of non-verbal communicative abilities. The third is the challenges in developing and maintaining relationships. So you need all 3 criteria in order to have the diagnosis, plus 2 out of the 4 non-social. So the 4 non-social would be the stereotype behavior, like rocking or hand flapping. The second is cognitive inflexibility, like doing things only a certain way and don't want to do other things. And change to other way. The third is the restricted interest. So some people have very, very deep interest. The fourth is sensory abnormalities. Can be hypo sensitivity or hypersensitivity to any of the modalities. Sensory modalities can be auditory, can be visual, can be taste or smell, and so forth. So you know these criteria sometimes to me there's actually very little overlap with schizophrenia, although their presentation can sometimes look similar. So autism typically basically it's not typical. It's by definition it has to start from early age. It has to be in the early years, the first few years of life. Schizophrenia, on the other hand, usually starts the symptoms in teenager years. It is very, very rare for someone to have symptoms before teenager years. It's possible, but it's very rare. When there is schizophrenia in very early years, it's not typical schizophrenia. It's actually childhood onset schizophrenia. In those cases, they have hallucinations and delusions, which are very different from the symptoms in autism. So the reason why the childhood schizophrenia was put together with autism is because of the historical nomenclature. At one point, basically the autism, the diagnosis of autism, it was actually named as one type of schizophrenia. But that was 40 years ago. So no longer. So in the United States, it's very, very rare for someone to have both autism and schizophrenia. It is possible, and I've seen them, but it's extremely rare.
Thank you very much. Есть вопросы по этому поводу, да?
Спасибо, сейчас очень интересную тему затронули, и поскольку я клинический психолог, меня интересуют чуть-чуть совсем вопросы диагностики. В частности, на что больше опираются в вашей школе, там, в Стэнфорде и так далее, на аппаратные методы диагностики, на методы тестирования, то есть с закрытыми вопросами, Либо у нас это называется проективные методы, такие, где как бы психолог или доктор, соответственно, больше интерпретирует его наблюдение. То есть где у вас акцент ставится в американской психиатрии, в частности. Спасибо.
So for autism, typically the diagnosis is made by definitely the clinical interview, and establishment of the diagnostic criteria that I just told you about. And a lot of the time we have standardized tests, and the two main standardized tests are ADOS, ADOS. It stands for Autism Diagnostic Observation Schedule. And the second one is ADOS is basically the clinician playing with the kid, and the second one is an interview of the parents. So that's called Autism Diagnostic Inventory Revised.
Еще вопросы? У нас еще есть время.
Спасибо большое. Меня интересует такой вопрос. В США, если ставится ребенку диагноз аутизм, этот диагноз ставится на всю жизнь или через какое-то время его могут снять? Например, после EB-терапии довольно активной у ребенка появляются какие-то навыки, и аутизм уже не считается аутизмом. Может ли такое быть? Спасибо.
So I think there is no rigid laws or regulations about taking away the diagnosis once autism is established. It is really depending on the physician or the psychologist, whoever the clinician decide. And to me, whatever I do is really about helping the patient. And sometimes that means a diagnosis is the most helpful because the diagnosis can get the person the right treatment. This way they can actually have coverage, their insurance company will pay for it and so forth. But you're asking about taking away the diagnosis, which is really for the patient. If the patient really has no symptoms whatsoever, and I really believe that this is actually for the best interest of the patient, I will consider not including the diagnosis as an active problem. So it can be a historical diagnosis in the chart, but I don't necessarily have to put it as an active diagnosis.
Здравствуйте, спасибо вам за ваш доклад. Я работаю в университете, и у нас как раз есть студенты с аутизмом. Да? Единственное, некоторые сложности в плане диагностики после 18, но это решаемо. Хотелось бы узнать, как ваши педагоги приняли саму по себе концепцию того, что люди с особенностями в развитии будут обучаться, и в любом случае необходимо дополнительное какое-то сопровождение. Как они к этому отнеслись? Уровень толерантности, какие-то дополнительные курсы проводили или нет? Спасибо большое.
So when I was talking about the Stanford Neurodiversity project, especially the part about the student support program, what we are trying to do is to identify what the student may need, and we will give the services to the student. And we are also trying to teach the professors so that they know what to look for. And sometimes they may not know exactly what to do, but they can actually talk with our group and we may be able to help the professors.
Еще вопросы? Все? Ну, тогда отпустим профессора Фанга. Thank you.